Welcome, everybody, to OPTP's Next Level. We have an amazing person for you today, Dr. Jared Vagey. I am so excited to hear what he has to tell us. Just give you a little bit of a background for this Next Level. Again, we bring in expert clinicians to talk about how they have taken education and their experiences and brought them to the next level. So Dr. Vagey has done, he did his DPT training at University of Southern California, USC. He did a residency. He is now an assistant professor in that program there. He has some books that he has written about, which I want him to talk a little bit more about that. And he's done some amazing stuff also with the United States Olympic and Paralympic committees, and hopefully he'll talk to us a little bit about that. Coming up here. So please stick around. This is going to be a great episode today. So Jared, talk to me about introduce yourself. Give us the who are you? Who is Dr. Vagey?
All right. Well, first of all, yeah, thanks for having me on. And I mean, beside all the credentials and the things that you mentioned, I think my story of how I got into treating athletes in a particular sport is actually quite interesting for a lot of people who are interested in working with athletes. And then really how I've been able to take that and branch that into some specialty care. But I'll tell an interesting story behind how I started working with my favorite sport, which is rock climbing. And I'm a climber myself. I ran track in college, and there was a rock wall on campus. And I remember I tore my hamstring like 6 or 7 times, which was, that actually got me into PT. But I tore it 6 or 7 times. I remember there's this rock wall on campus, and the second I touched the rock wall, I was hooked, and I was climbing all the time. I was even hanging from the door frame of the apartment I was at with my fingertips, multiple times a day, just to get my fingers strong for climbing. And I vividly remember, this is like fast forwarding, I was in physical therapy school at USC, and I hung from my fingers 6 days straight. And I was so tired. I kept climbing. A friend invited me out to this place called Joshua Tree for some outdoor climbing. I was getting on this route. The route's called Course and Buggy. And I just remember I was so exhausted. My legs started shaking. My arms started shaking. I got right to the end, which is the exit move to pull over the top of the route. And I heard 2 pops. I heard a pop in my finger, one in my shoulder. I tore my rotator cuff and a ligament in my finger at the same time. But I did finish the climb.
Good job. And congratulations.
Thank you. And anyway, but that was the point. I realized I started rehabbing myself. And then I started thinking, well, I wonder if I could rehab climbers as a goal, because that's what I am. And I reached out to some magazines. They were quite popular at that time, and actually got a column in a magazine. I started writing a lot on the topic, did some research, and started writing a book. And then became my life. I started just treating climbers. That was my emphasis. And I was treating kind of novice climbers, beginners, and then I started working with some of the top climbers in the world. And that really gave me an introduction to working with elite level athletes. And that was how I got into working with athletics at a high level. That was my almost entry point.
Wow. Isn't it like most of us therapists, we find something that we get hooked on, we get injured, and then it kind of cycles that through. So that's really awesome. So you kind of talk about, how you decided to get kind of specialized in that because of your background. Were there other things like, a patient that really kind of oh, that, now this is really what I want to do, besides just your own personal climbing and getting hurt yourself? But was there some patient that yeah, this is what I could really see myself doing, of treating climbers?
Well, I think I was treating a lot of climbers, but I always wanted to expand past climbing to just all sports. And in particular, track and field, that's where I originally had got injured, was a soft spot for me. And just all the different movement patterns in sports were so interesting. And so I remember this was during my fellowship training. My mentor, Claire Frank, she's amazing. She'd worked with so many different high-level athletes. Lillian Chen, a colleague of hers, was putting together a team of physical therapists to go to China to work with the Chinese national track and field team. And at that time, there wasn't really physical therapy in China. So this was the first introduction of the team to like Western medicine. And Claire was unable to go at that time. I think she had gone previously, but she was at that one time, she was maybe teaching a course or something like this. And she had sent a call out to her mentees and other colleagues. Can anyone fly to China to work with the national team? And I remember I got that, I forget if it was a call or an email, but I was working for a clinic at that time. And I literally just said, yes, I'm in. Like, I didn't ask anyone. I just like accepted the possibility. And, you know, before you know it, I was flying over to China, and I had the amazing opportunity to work with the national team there, and had some crazy stories and experiences with the athletes. And from there, when I got back, I really realized I wanted to work in elite athletics. And so I applied for the U.S. Olympic Committee's sports medicine volunteer program, where they slot you in different Olympic training centers for 2-week rotations. And so I went up to Colorado Springs. I went down to Chula Vista. From there, I met the national governing body directors of different sports, and then started connecting with those different sports, you know, traveling with USA Swimming, USA Weightlifting, and other groups, and then just started consulting and working with elite athletes individually and building programs based on movement. And so it really just kind of started with rock climbing. It ballooned with this opportunity that I didn't think twice. I just said, I'm there, I'm going. And I was part of it, you know, obviously a team there. I was there alone, but other people had gone before me. And then it branched off into all these different directions. Just getting the foot in the door was that opportunity.
Yeah, well, that's amazing. I mean, isn't that like so much of our lives that we see an opportunity and we have to decide, do you go for it or not? Do you move forward with uncertainty and the risk, and you took it, and look what it's become. So that's awesome. I think that's what, a lot of new clinicians, do we play it safe, or do you make that jump? And pardon the pun, jump, with climbing and stuff. But that's a really interesting story of how you got there. And, again, you put in some volunteer time and, of traveling, and that's pretty cool there. So cool. So, with all of your background, the fellowship, and, going all over, and, working with high level athletes, is there been like one tool that you feel that has really helped take your regular patients or those athletes to that next level, that you've used to enhance your strategies? Do you think other clinicians should know about there? What's that, kind of that secret that you have? Like, I bring this out. I don't let everybody know it, but you're going to let our people who are watching this next level event by OPTP know about.
Yeah, it's your brain and your eyes. That's two tools, but I really think that movement analysis, my ability to recognize movement patterns, has really played a strong role. I see a lot of athletes after they've seen 2, 3, 4 different clinicians.
Yeah.
And what I've found is a lot of clinicians do an excellent job of identifying the source tissue that's generating symptoms. They can identify the pathology, but the contributing factors, the movement patterns, the inefficiencies that are leading to it, are really where I feel my skill set's really blossomed. And what that takes is a lot of patience. I'll be the first to admit, I'm not the best at analyzing movement. Other people see things quicker. When I was in PT school, they would have someone like walk in front of us and say, what do you see? And there would something be like very obvious, like there'd be a pelvic drop. And like everyone would raise their hand and nod their head. And I'd be like, I don't know, what is that? What's going on? And I couldn't see it. And so I put so much effort into videoing, recording movement, replaying it so that these patterns become more recognizable. And something as simple as a pelvic drop, of course, now I can spot that a mile away, but it came with training. And then to be able to do this with elite level athletes in their sport, now you absolutely need video analysis and your mind to be able to put those pieces together. So I'd say, yeah, the number one tool would be your movement analysis skills. Number two, I know you didn't ask that, but that would be your clinical reasoning. So your ability to then piece it together. And then number three would be your knowledge of anatomy. And for any clinician that can combine all three of those, I think you have a really powerful skill set.
You know, I've worked with several high-level athletes also, and even the recreational ones, the high school ones. And sometimes the higher level, they have incredible strength and incredible compensation mechanisms that, like, oh, of course they have, this is strong. And you look and like, no, there's actually weakness here. That's why, you know, they can squat 500, 600 pounds. They can do these amazing things. And I'm sure with rock climbing, you know, people are hanging on by their fingertips before they make that last maneuver. But they have developed compensations for those areas of weakness, and that's what got them into problems. At least that's what I've seen. I'm sure you see yeah. And it's us who have to try to figure out what's the underlying, because as you said, anybody can figure out like, oh, you hurt here. Yeah, the patient says, I hurt right here. I hurt right there. I hurt right there. But it's like, why do you hurt there? You know, why is that getting overworked? Why is that tissue not adapting to the loads that you're putting on there? What else is not doing its job? So
yeah, and it becomes, you know, easier to find the compensations with elite level athletes doing the same thing repetitively. It becomes harder to determine which of those are useful for the sport and innately built in, and which ones you have to change. Because, for example, you look at a fencer, they're going to have some huge asymmetries based on a movement pattern that they're constantly doing. And so the challenge is then teasing out which are appropriate to address and which are needed compensations for the mechanics in their sport.
Yeah. What have you seen being the most asymmetrical sports that you've been able to work with?
Ooh, yeah, that's a good question. I think it really depends on the sport. I think the most symmetric sports, like, for example, the sport I do the most, climbing is very symmetric because you're on all different problems going in every direction. So the sport in itself leads to symmetry, but athlete may be working on a project, or a climber working on a project for 2 months that only goes in one direction. And now they're building asymmetries in kind of a microcosm. You look at fencing, you're always leading with one foot in one direction. So there's asymmetries in almost every single sport if you search for them. I don't think there's a single one that we can point to.
You know, my background is speed skating and, you know, going fast, turning left. So, you know, we bend our skates, we bend our blades, we offset them, everything we do, you know, going straight and then turning left around those corners. And we have huge asymmetries. You know, one leg we have great internal, other one we have great external. You can go the other way. Nope.
Because it's like, you're like, can't you probably maybe do some training opposite direction on the track, right?
Yeah. So awesome. So you shared a little bit about some of, you know, the teams and stuff. I'd like to dive in a little bit more with, you know, powerful patient, you know, success stories you've had. You know, we like to hear about those, what things have worked well. How have you made that impact on an athlete? Again, we want to maintain HIPAA and all those types of things, but, you know, what are some of the impacts you've been able to make, and how did your education help you make that? And I think I already know the answer to this one, but I'm eager to hear what you have to say about that.
Yeah, there's so many patient stories. I think I'll go on one of them that really changed me as a clinician. So maybe people who are listening can understand the power of it. Let's go back to when I was talking about I was working in China. So I was working with the national team, and there's a language barrier.
Yeah, when was this? Just sort of
this
frame of
must
reference.
have been. I have to go back. This must have been like, maybe like 9 years ago, 8 years ago, something like this. I have to look at the dates, but it was definitely, Let's say 8 years ago. Let's run off of that. So this was early. Maybe it was 10 years ago. I don't know, somewhere around there. But this was early on, kind of in me branching into athletics and, kind of higher level athletics. And I remember I was going in not really knowing how to connect with the athletes. And there was an athlete there, is a long jumper. He was top at that time, 7 or 8 in the world. And he had a grade 2 hamstring strain going into world championships, which was in 8 weeks. And so my job, one of my main components was to make sure he was ready for world championships. And so I go in, I show up, do my assessment. I have a game plan in my head off all my education. I'm really excited about this. First treatment session, I come in, I have him jog a lap around the track to warm up. And he jogs over to the ping pong table and he starts playing ping pong with his friends. And I'm like, what? Like, I have this game plan. And so I give him the physical therapy exercises and he doesn't do them. And he just walks away. And I was like, just had no idea how to handle this, because everything I had trained for, everything that I knew, I was ready to implement, but he didn't want to connect. And so I was like trying to sleep that night, and maybe I got like 3 hours of sleep, and I was just trying to rack my brain. Like, at first it was every treatment program I could do, every type of way that I could heal his hamstring. And then I shifted to, I can't do anything unless I can connect with him. Yeah. And so then I started going, I had this little book of like phrases in Mandarin. And so then I started like learning different phrases. I think one of them was like, wo yao mai mian bao, which means I'd like to buy some bread, and like all these different, like super random, like introductory phrases. And so I just was like, I'm just going to try and learn Mandarin and connect with him. And so I show up the next day, and granted, it's different than in the States over there. For therapy, it was 2 sessions each day for an hour and a half. Yeah. So I had literally 3 hours I had to fill with rehabilitation. So I go over and I say a couple different things. I forget, like, hi, how are you? Where are you from? He's just ignoring me. And then I said the phrase like, wo ya mai mian bao. And then he just started laughing. And just like, and then he told his friends came over, other guys on the team, and they started just laughing at my attempt at Mandarin. And then I was like, all right. And so I did a warm-up lap with him. We jogged around the track together. I did his rehab exercises with him. And then from there on, I just kept connecting. I taught him a secret handshake. I kept doing rehab exercises with him. And one of my, residency mentors, John Dravilis, actually told me, you don't want to butcher the quote, but no one cares how much you know unless they know that you care. Yeah. Yeah. Something along those lines. Yeah. And that totally rang true. And we rehabbed the heck out of him, 3 hours a day. He ended up he was the youngest person ever to get a medal in the long jump. He went on, I think a few years later, to become a world champion in the long jump. And it was just like, I'm still in touch with him. He's a great guy. And it was just one of those stories where it didn't really matter how much I knew. It mattered how I connected with him. Yeah. And then I could apply everything that I was learning to how to rehab that specific injury. Yeah. It's like that with, obviously, with all patients, but I think, at that high level, a lot of times, the physios, the PTs, or the athletic trainers, and, different people who are working with them may not know the sport, or they don't connect. And that's why a lot of, people they don't stick around the sport very long from the rehab side, because they don't develop those bonds. The team doesn't ask them back because there was no synergy and stuff. So for you to take that initiative to learn Mandarin and learn how to ask for bread, again, it's just showing that you're coming at this as either like an equal, or you're trying to understand them, you're trying to get to know them, build that therapeutic relationship, which we now know is so much of what rehab is building that therapeutic relationship. So I think all of our people who are watching should think about that next time they're working with an athlete, or the recreational one, or their whatever patient they have. How can they
build that therapeutic relationship. So that's a great story. And maybe we'll
Yeah, and
get
that
more
must
people
have.
asking about how to, where to buy bread.
Yeah, exactly. And I mean, that was earlier on in my career. And that's when when you're newer in your career, you think that the most important thing is what you know. And I think as you gain clinical experience, that shifts more.
What do they say about, the experts? They do the basics better than anybody else,
Yeah.
and yeah, I mean, we see these people who have been out there, like yourself, who have been out there for a long time, and you do the basics very, very well and connect and know exactly where to put, your tools, your approaches to go to the root cause, not just the symptoms, and getting in touch with the patient and in touch with those athletes. So. Well, I want to shift a little bit to talk about the rehab aspect you offer with EIM and the upper and lower half bundle courses. I want to talk a little bit about those, kind of what they entail, but also what are the things that people are going to take from that when they, what are they going to use on Monday after coming to one of your classes?
Yeah, I really built those classes. They're individual courses, so you can do upper half, lower half, or you can bundle them together. And when I was building them, the idea was that I would have all this information that I've gained, all this kind of clinical information, clinical pearls, but apply it to a structure. Because in our mind, we have all these skills, all these things we learn, but maybe I can do that in a moment, but to have someone kind of learn from my brain and kind of take that from me, I need to have a structure. And so I spent a long time, I think it was 4 or 5 years, to like really put this together. And the structure really goes into assessment, which is
Yep.
movement assessment, mobility assessment, muscle performance assessment, and it has your basic components, and then it builds from it. For example, with athletes, you have someone who's running and they hit heel strike, through impact, maybe let's say a loading response component, and you see that there's a dynamic knee valgus. Well, you have to take your assessments to another level and start thinking about, if you're doing an exercise to rehabilitate, for example, hypothesized gluteus medius weakness, you have to have the same cadence in that exercise as they're running for
Yeah.
it to carry over.
Yeah.
Or potentially, if you do an assessment and you assess their gluteus medius muscle and it actually tests strong, and you're wondering what's going on, you have to look at the opposite side of their body at quadratus lumborum, which holds up the
Yeah.
pelvis on the opposite side. Muscle test that to see if it's contributing. Or on another level, why are we doing a sideline gluteus medius manual muscle test when landing during impact is closed kinetic chain?
Yeah.
We should actually manual muscle test gluteus medius in the closed kinetic chain by pulling down on the pelvis on the other side. And so all these components, this is just a small example of it.
Yeah.
The course really breaks down what it means to assess an athlete. And then it drills into the biomechanics of each sport. I spent so much time on these like custom photos of the different components of the swim stroke, of the tennis serve. And then it builds into a pyramid that was adapted from one of my mentors, Claire Frank and Phil Page, a functional management pyramid that they put together. I adapted that for this course and kind of streamlined it for assessments. So it's really this kind of comprehensive set of different ways, trying to get my mind into a systematic format to treat athletes.
Yeah. Well, that's great. I mean, having that system approach, I think, working with residencies, working with fellows, working with, entry level students, that they have all these tools, they have all these skills, but then like, oh, how do I do it? And you got to figure out, what's your approach? How are you going to look at them? And having a system like you've described, is allowing like, okay, what should I do? What should I not do? Where should I test? How should I test? That makes it really seem like it's a good package that people will be able to do. And then obviously have to continue to keep on learning those things. But on Monday, after a course, they should be able to start to apply that information. At least what I'm kind of getting from you is that these things can be learned and catching that eye and stuff, of figuring out where to be looking and stuff. So that's really awesome.
Yeah, and I get so
So
many emails about, how the slides are kind of laid out as these PDFs of these cheat sheets. And I get an email,
yep,
I was able to take this page, have it right in front of me, and apply it to the patient in that exact moment. And I really built it to be a course that you can continue to reference clinically.
awesome. Well, bringing up that you said, people can email. I know you're on Instagram. Why don't you throw out those handles so people can, know where to look you up and stuff before we get to our last question and stuff.
For Instagram, for the climbing related content, it's at the climbing doctor, DOCTOR. And for the sports related content, global, all different sports, that's at athlete movement system.
Awesome. So that's great information for our people who are watching. Again, right before we finish up here, we just have a few more minutes and stuff. We have Jared Vagey, who is an awesome person to get to know. I've had a chance to get to know him a little bit, and hearing his background from Olympic sports, going to China, working at Olympic Training Center, and really focusing in on elite level athletes. And a lot of those have been climbing from himself. So, you know, the last one I kind of want to just follow up with is, and I think we kind of touched upon it a little bit, with your experience in that PT space, besides your brain and your eyes and being able to focus, are there, tools or techniques that you really believe in, that every PT should have at their disposal, or new people who are getting into this space, working with athletes, should really have or be able to reference to use because of what you've seen out there?
I just say the ability to pause, take a step back, and look at the big picture. I know it's not a tool, I know it's not a specific technique, but in mentoring situations that, I mentor at the residency level, I mentor at the fellowship level, I'm behind the resident, the fellow, and I'm watching them do their assessments and I'm watching them do their interventions. And it's always constant. It's always what's the next thing. And if you take a step back and you really take a bigger look at the picture and you pause, and I don't want to harp back on movement assessment because that's just a part of the puzzle. But if you start figuring out how the pieces fit together, they do fit together. And if your patient isn't getting better, you are missing something. And I find that pause, that step back, that moment of reflection really makes a big difference. And it's in real time. And it's also after you see the patient. So it's reflecting on your visit. I have this notebook. I'm old school. I write down in it all my reflections. And it's reflecting and pausing in the moment itself. I think that really makes a big difference for clinicians.
Yeah. Reflecting on action, in action, and for action. I can't remember. I remember reading that a long time ago, and I know I've presented on some of that stuff, but that reflection is what makes an expert clinician. Reflecting on action, in action, and for action for the next time. How much time, you talk about, hey, if patients aren't getting better, how much time do you give a patient before you say, okay, what we're doing isn't working. I need to look at something. I'm missing something. For yourself, what does that come down to nowadays for you? How much time?
There's short term and there's long term. Short term, we're always doing reassessment signs. And I provide an intervention. If that does not change something, then I need to determine, was it supposed to? And if so, I need to reassess and go a different direction. So in the short term, I'm always making those adjustments in real time. And I am okay with making a mistake. And I've been in this profession long enough, as I'm sure yourself. Yep. I will tell the patient, we're going to give this a shot. I have this hypothesis. It may or may not work out. I'm not going to lead them. I'm going to say, tell me, did this make a change? I'm not going to say, oh, did this make your pain get better? And kind of lead in that direction. That's actually one of my pet peeves mentoring. You do a mobilization, you're like, oh, how much better did that make you feel? And so it's No, that's
Yeah.
leading the witness.
Yeah.
And then in the long term, it totally depends on the pathology.
Yeah.
But typically, I look at 6 to 8 week windows and 8 to 12 week windows. If the patient is not significantly changing in those periods, we may need to reassess our game plan. But it's completely dependent on the pathology itself.
I think that's one of the things that talking with a lot of expert clinicians like yourself, that they're able to assess, that test, treat, retest kind of mantra that I think we all kind of learned and stuff. And hopefully that's continued to making their ways around in schools. But, we're able to make some changes in session. And whether it goes positive or negative, that gives us information. So like yourself, you're saying, hey, I think it's going to do this, or I think it's going to do that. I'm going to test this hypothesis. If it responds positively, it's probably more of X. If it responds Y, if it responds negatively, it's probably more of Y. And then that changes my next clinical decision making. So great. It's good.
And
It's good
that
to hear that what we talk about is actually what people live. So
Yeah, well, that's honestly what excites me. Like every patient I see, I am still excited. Why? Because I'm on the spot. And, whether it's a recreational athlete or whether it's one of the top athletes in the world in their sport, I am literally on the spot in that moment to perform. And my heart's still beating quickly. I'm like, I don't know. Is this going to happen? Is it going to change? And that excitement of, you know, being able to make a change or not and not knowing the response is kind of what drives me. And the longer you practice the fundamentals, the longer you're kind of in the game reassessing, the luckier you get more consistently with your assessment signs, making the patient better. So I've been very lucky to be getting lucky with my patients as of late. But I also have to be open that some things I do may not move the needle or may not change. And then I have to change my game plan.
yeah, well, I mean, it's a lot of it is about pattern recognition. It starts looking like a duck, it starts quacking like a duck. Hey, this is probably a duck, but I better go check. I'm going to make sure it's not a goose, and I'm going to check it to make sure it's not a goose. And when that's negative, great. Based upon my other stuff, it is a duck, great. I've used my sensitivity and specificity. Again, stats a little bit there, a little flashback. I'm sure you're all good on those, but it helps us to rule things out, rule things in, and using that test, treat, retest, and one last question before we go.
Yeah.
If you weren't a physical therapist, I have a feeling you'd probably be a detective based upon everything we've talked about. But what would you have been if you were not a physical therapist?
Yeah, I mean, a detective would be amazing, or but it's so funny. So before this interview, I like looked over to my left and I saw like a picture that was like hung that was like out of alignment, and so I went over and I was like, oh, let me fix that. And as you can probably tell, my head's not like perfectly center, but like my background's kind of set up, so I'm kind of like lined in like right between those two lines, the things on the side. So something that has to do with like lining things up. I don't know, like I don't know, what would be a profession that you really have to like
well, architecture, building
yeah,
design. I want those
architect or
buildings up and straight. I don't want them leaning unless it's a Tower of Pisa and stuff. So
my sister is a graphic designer, and she does these big projects where she looks at the page and makes sure that everything is like in the perfect spot. And so this is a quick side note, but we'll go to a restaurant together and we'll look at the menu and we'll find anything that's out of line on the menu, any font error, anything that's like not italicized. So I don't know, some profession that involves fine tuning OCD skill sets. But honestly, I think physical therapy fits my neurotic behavior pretty well. So I don't know. I can't imagine being in any other field than PT. It's a
it's
gift.
an awesome field. So Well, my name is Matthew Brough, physical therapist. We have Dr. Jared Baggy, who has been an excellent guest. Thank you very much for joining us on Next Level with OPTP. We know where we can find you. We know that we can find you and follow you on Instagram. We also have obviously the EIM courses that we can take, that sports rehab for upper and lower. I am so thankful for you joining me today and being able to talk about your background and how you got to where you're at and those tools that you think about and using those brains and watching people a little bit more. So, Dr. Vay, thank you so very much for being on today.
It's a pleasure.
Thank you very much.